Okay.
Hi, my name is Vijayna.
Hi, my name is Sid.
Hi, nice to meet you.
Nice to meet you too.
Thank you. I know you're here to know about heart failure, heart attack, and then skin heart disease. I'm happy to explain to you. As you know that heart is a muscular organ,
Yeah.
and that's one pumping blood to the throughout the body and also provide nutrients, and it removes waste from the body. And coronary artery is the one giving blood circulation to the heart. As we all know that heart has four chambers: right atrium, right ventricle, left atrium, and left ventricle.
Yeah.
And there are the heart failure is a main concern now. So ischemia and myocardial infarction, that's one causing heart failure. In ischemia, there is a blockage or narrowing of the artery. So the heart is not getting enough blood circulation. So often, like over time, heart muscle get damaged, and eventually it leads to, because of the ischemia, it leads to heart failure. And in myocardial infarction, that is called a heart attack. It is an emergency condition in which there is a blockage of the artery, so the heart is not getting blood circulation at all. So infarct means dead tissue because of lack of blood supply.
Oh.
Yeah.
Okay.
So the heart is not getting blood circulation, so heart muscles die, right?
Yeah.
So in all the you can say that there is a structural and functional changes in the heart. That means there is a scarring inside the heart, also impairment in the ventricular function because heart is not able to pump as normal. So in heart failure, because the ischemia and myocardial infarction causes heart failure. So that means heart is not able to pump effectively because of the heart muscle damage.
Oh, okay.
Yeah, and then ventricle is the one responsible for the pumping of the heart. So impairment in the left ventricular function causes back pressure to the blood into the left atrium and into the pulmonary veins and to the lungs. So it causes shortness of breath to the patients because of the heart failure.
Oh, okay.
Yeah, and signs and symptoms include patient will be having shortness of breath,
Yes.
and paroxysmal nocturnal dyspnea. That means the patient will be awake in the middle of the night, and and gasping for air.
Yeah.
And they'll be walking inside the room and looking for, opening the window to get fresh air. And there is no one is orthopnea. That means when the patient is sleeping, they use a small pillow to support their back so they can almost like upright position. So you can ask the patient how many pillows they are using to know the severity of the heart failure or shortness of breath.
Okay.
And it can cause peripheral edema also because of the pooling of the water or blood. Yeah, and risk factors include hypertension, hyperlipidemia, that means high cholesterol, diabetes, lack of physical activity, smoking, then hereditary, and obesity, and if the patient get aged, there is a high chance to get heart disease.
Yeah.
Yeah.
Okay.
And the treatment include there is a medical management, lifestyle modification, and surgical management. In lifestyle modification, you can change the diet and then increase physical activity, stop smoking, alcohol, and then in the medical management, there are some medication really help to alleviate the symptoms. Yeah, beta blockers, calcium channel blockers. There are some medications. Yeah, and also surgical management. If there is any blockage in the artery, that's a time there needs surgical intervention. Prognosis, that is very important. If prognosis in heart failure, prognosis is very poor. 50% of the patients who diagnosed with the heart failure, they die within 5 years.
Okay.
But recent, improvement in the medical field, that means, it is, it improves the quality of the life and progressive, elevate the symptoms of the patient. So the patient can live longer if they, comply with the medication and follow a good lifestyle. Do you have any questions?
Yeah, I have one question. How does high blood pressure affect the heart?
Oh, the high blood pressure, because in the high blood pressure there is a strain in the artery, like in the blood vessel. So that can cause, over time it can cause a thickening of the blood vessel and it becomes stiff. So that's the reason the high blood pressure leads to heart failure.
Thank you. I have another
question.
What's the reason for shortness of breath?
Oh, Yeah, shortness of breath because you know the left ventricular failure. That means in heart failure, the ventricle is not able to pump. Heart is not able to pump effectively, so the blood back flow to the lungs and into the pulmonary veins. So that's the time patients get in the shortness of breath. So it is actually worsen at night when they are sleeping. Any other questions to me?
How long does a patient with heart disease take medicine for?
Oh, yeah, that's a good question. Unfortunately, they have to take medication lifelong because it's not a curable disease. It only, yeah, I know, sorry for that.
I know.
Yeah, it only alleviate the symptoms, but you know, like if they continue taking the medication and modify their lifestyle, it helps them to, you know, live longer.
Oh, okay.
Any other questions?
No.
Oh, thank you so much. It
You're
was
welcome.
nice meeting you,
Nice to meet
and
you too.
you have a great day.
Yeah, you too.
Thank you.